If you are over 65, there is a very common daily pill that can quietly push your heart toward a dangerous edge without warning, and if you take it the wrong way, this video could literally save your life. I am not saying this to scare you for clicks, I am saying it because I have seen it happen in real life to good people who thought they were doing the safe, responsible thing, taking a pill they could buy anywhere and taking it exactly the way they have for years. Imagine this: you wake up stiff in the morning, maybe your knees ache, maybe your back grabs you the moment you stand up, and you reach for the same bottle you always reach for. Because it helps you move, and because you have a life to live. You have groceries to carry, grandkids to hug, stairs to climb, and you do not have time to be in pain. So you take the pill with a sip of water, and you move on. And that is where the danger begins, because the damage I am talking about does not feel like a heart attack. It feels like nothing at all. Let me say it plainly: the pill I am talking about is the family of pain relievers called NSAIDs, like ibuprofen and naproxen, and in some people, especially after 65, they can quietly raise blood pressure, strain the kidneys, and tip the heart into trouble while you are still feeling like you are doing everything right. Before we go any further, if you are someone who cares about staying independent and protecting your heart as you age, I want you to subscribe to the ATIA Reset Health Tips and stay with me. Because I make these videos the way I talk to my own patients: calm, honest, and protective. I would rather you hear this from me now than from a doctor in an emergency room later. Now I want you to picture the kind of person this happens to, because it is not always the person with a big, obvious history of heart disease. It is often the person who is careful, the person who takes their morning walk, the person who tries to eat better, the person who checks their cholesterol, the person who says, "I do not smoke and I do not drink much, so I am fine." Then one ordinary week, they get a flare-up in the shoulder or hip, and they take ibuprofen for a few days, maybe a week, maybe longer. And the heart begins to carry a heavier load, and they do not even know it. Here is the part most people never connect. Pain pills like these do not just touch pain. They also change how your body handles blood flow and salt and water. They can make your body hold on to fluid like a sponge. That extra fluid increases pressure inside your blood vessels. Higher pressure means your heart has to push harder every single beat. And the older your arteries are, the less forgiving they become. You might be thinking, I have taken it for years and I am still here. I hear you. I have had patients tell me the same thing. But the body changes with age, and the risk changes with your health conditions and your other medications and even your hydration. Something that was tolerated at 50 can become risky at 70. And the scariest part is you might not feel anything until the day your ankles swell, your breathing gets heavy, or you wake up with a pounding headache and a blood pressure reading that makes your stomach drop. Let me tell you a story that I wish I did not have to tell. A woman in her early 70s came in because she felt unusually tired and a little short of breath when walking to her mailbox. She did not have chest pain. She did not have that classic crushing feeling people imagine. She was just tired. She thought it was age. When I asked about her daily habits, she mentioned she had been taking naproxen for her knee because she wanted to keep gardening. She said it helped, and it felt harmless because it was over the counter. Her blood pressure was higher than her usual. Her legs were slightly puffy, and her labs showed her kidneys were struggling more than before. That was the moment everything clicked. This is why the pill can be silently damaging. When the kidneys get stressed, your body can retain more fluid and your blood pressure can rise. Your heart does not complain with a sharp pain at first. It just works harder and harder until one day it cannot keep up. And if you already have any degree of heart disease, even if it has never caused symptoms, this pressure and fluid shift can be the match that lights the fuse. Now let us talk about something that surprises people. Even if you do not have diagnosed heart failure, you can still have the early version of it building quietly. Many seniors do. A little stiffness in the heart muscle. A little less ability to relax between beats. That means the heart is already operating with less reserve. And when you add an NSAID on top, it is like asking an older engine to pull a heavier trailer uphill. It may do it for a while, but the strain is real. I want you to pay attention to the hidden signs, because these are the things people dismiss. Shoes feeling tighter than usual at the end of the day. Rings feeling snug. A sudden 2 to 5 pound weight gain in a few days without changing your eating. Waking up more at night to urinate. A new shortness of breath when you climb stairs. A feeling of pressure in the chest that you cannot quite describe. And the one that breaks my heart because it gets ignored the most. fatigue that feels like you aged 10 years in 1 month. Here is where I need you to stay with me, because most videos stop at fear, and I am not going to do that to you. I want you to understand exactly who is at highest risk and what to do instead so you are not stuck choosing between pain and your heart. First, let us talk about why this gets more dangerous after 65. As we age, our kidneys filter more slowly. Our blood vessels tend to stiffen. Many people are on medications that interact in quiet ways. Blood pressure pills, water pills, ACE inhibitors, or ERBs. Sometimes a baby aspirin, sometimes a blood thinner. When you mix an NSAID into that situation, you can create a perfect storm where blood pressure rises and kidney function dips and fluid builds. Not always, but often enough that it deserves your respect. And I need to say something that might sting a little. Over-the-counter does not mean low risk. Over-the-counter often means people take it longer than they should without medical supervision. People double up because pain is miserable. People take it on an empty stomach. People take it when they are dehydrated. People take it while they have the flu or diarrhea, and their kidneys are already under stress. And that is how a normal dose becomes a dangerous dose for that body on that day. Now I promised you a doctor-patient conversation, so I am going to ask you a question the way I would in the exam room. What do you take on a normal week, not on your best week? Not when you are trying to impress your doctor. On a normal week, how many pills do you take for aches and pains? How often? And do you take them for days in a row? Because here is the cliffhanger that matters, and I want you to remember this line. The risk can jump sharply when the use becomes more than 3 days in a row or the dose becomes more than the label minimum, especially if your blood pressure is already creeping up. Most people do not realize there is a line where the body stops compensating, and that line is different for each person. But once you cross it, the heart and kidneys can start to spiral together. Let me show you what I mean in a visual way so you can feel it. Editor, please show a heart ultrasound clip and then an artery animation where the vessel narrows and the pressure inside increases, and then show fluid pooling in the ankles like a subtle swelling. Because this is what I explain to patients when we look at a scan. The heart is squeezing and squeezing, but the pressure in the system is higher than it should be, and the body is holding on to water, and that extra load has to go somewhere. Now I want to calm your nervous system for a moment, because some of you are panicking thinking I took ibuprofen yesterday. Brief. One dose does not equal disaster. The goal is not fear. The goal is awareness and smarter choices. The danger is chronic use, frequent use, high-dose use, or using it when your body is vulnerable. So what should you do if you are over 65 and you rely on these pills to function? Here is the truth. Sometimes an NSAID is appropriate for a short window with your doctor's blessing, especially if you do not have heart failure, kidney disease, uncontrolled blood pressure, or certain other risks. But you need a plan, not a habit. And you need to treat these pills like a real medication with real effects, not like candy. The first step is to check your blood pressure at home for a week during and after you use it. If you notice your numbers creeping higher, that is data your body is giving you. Do not ignore it. The second step is to pay attention to swelling and sudden weight gain. The third step is to drink water normally and avoid NSAIDs when you are sick, dehydrated, or not eating well. Now let us talk about what you can do for pain that does not gamble with your heart. Many people do well starting with acetaminophen when appropriate and within safe dosing especially. If you do not have liver issues and you do not drink heavily. Some people benefit from topical anti-inflammatory gels because they can deliver relief to a joint with less whole body effect. Some people need physical therapy not because pain is in your head, but because weak stabilizing muscles force joints to grind harder. Some people need better footwear or a cane for a season, not forever. Some people need a smarter anti-inflammatory eating pattern and gentle movement that keeps blood flowing. And some people need imaging because persistent pain is your body asking for a deeper answer. I also want to say this with compassion. Many seniors are living with pain quietly, and they deserve relief. You deserve relief. You are not weak because you need help. But the goal is relief that does not steal years from your heart. If you are someone with a history of heart attack, stroke, stents, heart failure, kidney disease, or high blood pressure that is hard to control, I want you to take this especially seriously. In those cases, even a few days can be enough to tip the balance. And if you are on a blood thinner or aspirin, you also have to think about bleeding risk in the stomach. And that is another quiet danger that can show up as fatigue or dark stools or dizziness. Let me tell you what I wish every family knew. The emergency room does not always see the simple story that caused the crisis. They see the fluid in the lungs. They see the blood pressure emergency. They see the irregular heartbeat. They see the kidney numbers. But the slow build started at home with a normal bottle in a normal cabinet. That is why I am speaking directly to you like this. Now here is the empowering part. You can reduce this risk starting today without suffering. You can make a short list of your pain triggers. You can set a rule for yourself that you do not take. NSAIDs longer than a couple of days without checking in with your doctor, especially if you have any heart risk. You can keep a home blood pressure cuff and treat the readings like a dashboard, not a judgment. You can ask your pharmacist to review your medications for interactions because pharmacists catch things that busy clinics sometimes miss. You can bring the actual bottles to your next appointment and ask one simple question. Is this safe for my heart and kidneys? And if not, what is my safer plan? Some of you are thinking my doctor never mentioned this. That does not mean your doctor does not care. It means the system is busy and you may not have mentioned how often you take it. Many people do not mention over-the-counter meds because they do not think they count. From this day forward, I want you to make them count. Let us do a quick reality check together. If you take ibuprofen or naproxen more than once a week. If you take it for more than a few days in a row when pain flares. If you have high blood pressure, diabetes, kidney issues, swelling, or any heart history. If you have ever been told your kidney function is borderline. If you have ever been told your heart is a little stiff. Then you are exactly the person I made this video for. And I want to offer you a moment of hope that feels real. I have seen people come off frequent NSAID use, and within weeks their blood pressure improves, their swelling reduces, their breathing feels easier, and they feel more like themselves. Not because they became perfect, but because the extra burden on the system came down. It is one of those small changes that can create a big ripple. Now I want you to listen carefully because this next part is the kind of detail that can prevent a crisis. If you ever take an NSAID and within a day or two you notice new shortness of breath, new swelling, a sudden jump in blood pressure, chest tightness, unusual fatigue, or you gain a few pounds, quickly do not push through it. Stop and get medical advice. If symptoms are severe, or you feel faint, or you have trouble breathing, do not wait. That is not being dramatic, that is being wise. You have worked too hard to lose your health to something preventable. You have people who need you. Even if you live alone, you still matter. Your life still matters. And your heart has carried you through every hard season you have ever survived. It deserves protection now. So here is what I want you to do after this video. Look at your cabinet. If you have ibuprofen, naproxen, or similar pain pills, do not throw them away in panic. Just treat them with respect. Write down how often you actually take them. Check your blood pressure for a week. Pay attention to swelling. And schedule a conversation with your doctor or pharmacist to build a safer plan for your pain. That is what adults do. That is what wise people do. And if you want me to help you personally in a way that builds this community, leave a comment and tell me your age and which pain you battle most: knees, back, hips, shoulders, or headaches. And tell me if you are currently using ibuprofen or naproxen. I read these and they guide what I make next because I want this channel to feel like a clinic where you are actually seen. Please share this video with one person you love, especially someone over 65 who keeps a pain pill in their purse or in their car or by their nightstand because they think it is harmless. Do it with kindness, not fear. Just say, I watched this and it made me think of you. And I want to leave you with this final reminder. Your heart is not just an organ. It is the engine behind every laugh, every hug, every walk, every holiday, every ordinary morning you still get to wake up to. Protect it like it is precious because it is. You are not powerless. You are informed now. And when you are informed, you are safer.